Now we'll discuss about the plasma cell disorders. Now second topic is the plasma cell disorders. Now when any antigen came into our body, this B cell will transform into the plasma cell, and ये plasma cell further जाके क्या बनाएंगे? They will form the immunoglobulins. Now अगर यहाँ पे when this B cell is gonna transform into plasma cell, अगर इस point पे कोई mutation आ जाए तो what is gonna happen? This mutation leads to what? This will leads to multiple myeloma. आपको पता है जब multiple myeloma में क्या होता है? जो there is a abnormal प्लाज्मा सेल्स, अगर एबनॉर्मल प्लाज्मा सेल है तो एबनॉर्मल एंटीबॉडीज़ बनेंगी. सो हमने बोला जब बी सेल ट्रांसफॉर्म कर रहे थे प्लाज्मा सेल पे, उस टाइम पे म्यूटेशन हो गया, तो ऑब्वियसली जो भी प्लाज्मा सेल होंगे वो क्या होंगे? एबनॉर्मल होंगे. सो दिस म्यूटेशन विल लीड्स टू मल्टीपल माइलोमा. ओके, एंड यहाँ पे कुछ ट्रांसलोकेशंस आपको याद रखनी है. फर्स्ट इज अ ट्रांसलोकेशन 4 and 14, second translocation 11 14, and third is the translocation 14 16. And out of these translocation, this is more common. This 11 14 translocation is more common. Okay, now see, जब multiple myeloma repeat, now this mutation leads to multiple myeloma. अब multiple myeloma में what I have told you, there is a more abnormal. So ये abnormal plasma cell क्या करेंगे? They will form what? They will form more abnormal. They will form more abnormal antibodies. अब ये जो एबनॉर्मल एंटीबॉडीज़ हैं, ऑब्वियसली नॉर्मली एंटीबॉडी का क्या फंक्शन होता है? वो इन्फेक्शन से फाइट करने में हेल्प करती हैं, बट एज दीज एंटीबॉडीज़ आर नॉट नॉर्मल, सो दे कांट फाइट अगेंस्ट इन्फेक्शन. दे कांट फाइट अगेंस्ट इन्फेक्शन. सो इन्फेक्शन के अगेंस्ट इफ दे वोंट फाइट, सो यहाँ पे पर्सन में मोस्ट कॉमन कॉज ऑफ डेथ क्या होगा? दैट इज इन्फेक्शन. मोस्ट कॉमन कॉज ऑफ डेथ. सो द मोस्ट कॉमन कॉज डेथ इज इन्फेक्शन. नाउ विल डिस्कस व्हाट इज द क्राइटेरिया फॉर डायग्नोसिस मल्टीपल माइलोमा. सो criteria. So you need to remember one criteria. Now how we gonna diagnose this multiple myeloma? For diagnosis we have one criteria. First you need to do the bone marrow examination, and on bone marrow examination what you gonna find? There is more than 10% plasma cells. There is a presence of more than 10% of plasma cells, and here you gonna find the presence of M protein. Okay, and there is one criteria that is known as the CRAB. Just remember this CRAB. Here in this CRAB, the C stands for hypercalcemia. This stands for hypercalcemia. Here R stands for renal failure. A stands for anemia, and B stands for what? Bony lytic lesions. Bony lytic lesions. Okay, this bony lytic lesions is mainly because of increase of interleukin 6. इंटरल्यूकिन 6 अगर ज़्यादा बनेगा तो क्या होगा? ज़्यादा ट्यूमर नेक्रोटिक फैक्टर अल्फा भी बनेगा, एंड दिस ट्यूमर नेक्रोटिक फैक्टर अल्फा हैज़ व्हाट काइंड ऑफ एक्टिविटी? osteoclastic activity. This is having osteoclastic activity. और osteoclastic activity का क्या मतलब है? Means there is a absorption of the bone. That's why you will see this bony cut. Repeat. That's why you see here this bony lytic lesions. And ये generally ये bony lytic lesions है ना, ये आपको कहाँ देखने को मिलेंगी? Most commonly you see them. It is seen. Most commonly it is seen in vertebra. It is seen in vertebra. Okay. Now there are two other conditions. What are those two conditions? One is MGUS. This MGUS stands for Repeat. This MGUS stands for monoclonal gammopathy of undetermined significance. Okay. And second condition is the smoldering myeloma. Second condition is smoldering myeloma. Now see here, in case of MGUS, जो plasma cell count है, that is less than 10%, whereas in case of smoldering myeloma, here you see the plasma cell count is between 10% to 60%. Here in case of MGUS, what you want to find? Here the M proteins are decreased. The quantity of M protein is low, whereas in smoldering myeloma you will see the M proteins are high. Okay. Now in case of MGUS you can't find this CRAB. What is this CRAB? Hypercalcemia is there, renal failure, anemia and bony lytic lesions. These all are absent in MGUS. Whereas if we talk about this smoldering myeloma, same, this CRAB is absent here. Now in case of MGUS, this CRAB is absent. What is this CRAB? Hypercalcemia, renal failure, anemia and bony lytic lesions. These all are absent in MGUS. Whereas if we talk about smoldering myeloma, here same, this CRAB is absent. CRAB is only a feature of multiple myeloma. Okay. Now in case of MGUS you will find what? That is immunoglobulin M is present here. That is not present in case of smoldering myeloma. So these are the three plasma cell disorder that you need to know. One is the multiple myeloma, then the second is monoclonal gammopathy of undetermined significance, and the third one is a smoldering myeloma. Now see, now for the diagnosis of multiple myeloma, what you gonna do? For the diagnosis of multiple myeloma, you need to have any one criteria from the CRAB, okay, plus on the bone marrow finding you will have more than 10% plasma cell presence. Okay, अगर ये चीज़ें, this criteria is fulfilled, then the diagnosis of multiple myeloma is confirmed. Here you can also go for peripheral blood smear and CBC. And on this peripheral blood smear or CBC, what you gonna find? There is what? Rawlex formation. Rawlex formation. अब Rawlex formation का क्या मतलब है? यहाँ पे you will see these cells gonna pile up on each other. They will form this stack-like structure. This is called as Rawlex formation. Okay. Here you wanna see there is increase of plasma cells. Okay. And if we see the RBC count, they will be decreased. So you gonna see autoimmune hemolytic anemia here. Second test that you gonna do here, that is a electrophoresis. You can do electrophoresis. M protein generally अगर ये M प्रोटीन यूरिन में आएगा तो वी कॉल दिस एज अ बेंज-जोन्स प्रोटीन. वी कॉल देम एज बेंज-जोन्स proteinuria. Okay, when this M protein comes in the urine. और अगर ये serum में होगा, if it is present in the serum, then you wanna see M spike. You will see what? M spike. यहाँ पे जनरली जो IgG immunoglobulin है वो ज़्यादा होती है, उसके बाद IgA is there. So you need to remember this. Now if we talk about to albumin to globulin ratio, so what is gonna happen to albumin to globulin ratio? Here you will see albumin की quantity कम हो जाती है, whereas globulin will increase. And second, you can also do kidney function test here. Here you can go for X-ray or PET scan or CT scan. And even we can do here bone marrow biopsy, and on bone marrow biopsy you can find these abnormal plasma cell. You can find the abnormal plasma cell. Okay, now see, generally जो normal plasma cells होते हैं, जो normal plasma cells हैं उनका structure कैसा होता है? So this is a plasma cell and here there is a nucleus inside this. This normal plasma cell has what? Centric nucleus. A centric nucleus is there in this plasma cell. Now in case of multiple myeloma you will see different kind of plasma cell. So what kind of plasma cell you want to see? First, this is a cell. This is a plasma cell. And in this plasma cell you will see what? There is a M protein in the nucleus. This red color is what? This is a M protein. When M protein is present in nucleus, this kind of plasma cell is called as the 𝗏𝐻𝐿 plasma cell. 𝗏𝐻𝐿 plasma cell. Second kind of plasma cell that you want to see here, this is the plasma cell. Here is the nucleus, and here you will find the vacuoles. Now when these M protein making vacuoles are present in the cytoplasm, this kind of plasma cells is called as Mott cells. M protein making vacuoles are present in cytoplasm. This kind of plasma cells are called as what? These are called as Mott cells. Okay. Now third kind of plasma cell that you wanna see here, these are the plasma cell. This is the nucleus. Here you will see the M protein forming the droplets in the cytoplasm. Here the M protein is forming droplets in cytoplasm, and this kind of cells are called as Russell cell. These are Russell cells. Okay, and the last kind of plasma cell that you need to know, this is a cell, this is a nucleus. Here you will see this M protein is making a flame like structure. Here this M protein is making flame like structure, and it is called as what? It is called as flame cells. It is called as flame cells. So these are the various kind of plasma cell you need to know. First, when the M protein is present in the nucleus, we call it as a Dutcher cell. When M protein are making vacuoles in the cytoplasm, we call them Mott cell. And when M protein making droplet in the cytoplasm, we call them Russell cell. And when this M protein make a flame like structure, we call it as a flame cell. Now how you gonna treat this patient? So treatment. For the treatment, you need to remember one mnemonic, that is blood. So just consider it as a double O. Here B stands for bot. This B here stands for bortezomib. This L stands for lenalidomide. Cut repeat. This L stands for lenalidomide. Here D stands for dexamethasone. This stands for dexamethasone. So this is all about the plasma cell disorders. So thanks guys for watching this video.